Good morning. I probably have the most controversial talk, but I think it's really important. Uh, we're going to talk about adverse events and especially the huge number of articles coming out, lawsuits, etc., about the toxicity of kratom or metragine. We've talked about the pharmacology and how complex it is. The key big difference is that the kratom or metragine, the primary active compound, at least at this point, we think it's the primary active compound in kratom, is that it does not produce respiratory depression, or at least much less, because it doesn't recruit the beta arrestin pathway. That's the pathway that produces the respiratory depression and produces so many of the overdose deaths that we're faced with today. But it has a very rich pharmacology that includes many other receptors that I've listed up here. And the 7 hydroxymetragine is the metabolite that is more active at the mu opioid receptor than the parent metragine itself. But it is not present in fresh kratom leaves. The 7 hydroxy metragine that you measure is primarily from the metabolism of the parent itself. And we have almost coming out, hopefully, new data from humans with multiple doses of kratom, where we've measured both the metragine and the 7 hydroxy to provide some of the most important data for interpreting these concentrations that are coming up in these different postmortem cases. Now, the first evidence that came out about potential toxicity from kratom came out of Sweden, and they had 9 deaths that were called kratom overdose deaths. And my colleague, who's a good friend, Robert Kronstrand, at the National Board of Forensic Medicine in Sweden, they investigated these cases and they found out that they had been adulterated, so they added O-desmethyl tramadol, which is a very potent compound with respiratory depressant effects. And they determined that all of the 9 deaths had high concentrations due to this adulteration of kratom. Another big reason, as all of us have been talking about, the need for regulation to prevent individuals from either adding very potent opioid type compounds or even adulterating with additional metragine or 7 hydroxymetragine that might be there to increase its potency. In 2018, and this was brought up by Dr. Volkow, was the FDA announced 44 deaths that they said were due to kratom. When you look at those cases, and I look at every overdose case of kratom that's published anywhere, all of but one contained other potent respiratory depressants, other prescription drugs, or other illegal drugs. All but one. And that one single case, when it was investigated, ended up being due to a motor vehicle fatality. Okay. But that publication by the FDA has really increased the number of medical examiners and coroners who will call a death a kratom related death. And we're going to talk more about that. And it has certainly was involved with the scheduling of kratom in a number of states, some of which have now, with more science available, reversed that prohibition of kratom, and others are looking at it. The next big event about kratom toxicity and overdose came out of the Centers for Disease Control. And this is a group that looked into the state unintentional drug overdose reporting system. And in 2016 to 17, certainly part of our terrible opioid epidemic that we are in the midst of, they looked at over 27,000 overdose deaths, and 152 of them, less than 0.6%, had kratom or metragine identified in the case. Just identified in the case. And yet, medical examiners or coroners called almost 60% of these deaths due to kratom or metragine, a lot following the FDA guidance that it was a significant danger, public health threat. Of these, 80% were in individuals who were suffering substance use disorders. And in almost all the cases, they found multiple respiratory depressants, including fentanyl, which is so potent, an opioid, heroin, other benzodiazepines like diazepam and other benzos, prescription opioids, and cocaine. So they did, even the CDC found that most of these deaths were due to the presence of other substances, and in many cases, multiple substances. In 2019, Gershman et al. Looked at all Colorado deaths from 1999 to 2017, 19 years. And in that entire time, they found only 15 deaths that were listed due to kratom. In 11 of them, they found many, many different drugs that also contributed to the death. And they had a wide range of metragine concentrations. And also, currently, almost no one is measuring 7-hydroxymetragine, the more potent metabolite. And we're going to have a lot of data that will help interpret those concentrations. And one of the most important things is that in the future, laboratories measure both metragine and its more potent metabolite. So there was blood remaining from, there were 4 deaths that did not have other drugs listed as potentially contributing, and there was blood left over from 3. There was one case where there was no additional blood. When the Gershman did a more comprehensive toxicology evaluation, they found multiple drugs in 3 of the cases where there was blood available. So again, the importance of comprehensive toxicology. Many of you, I know Kirsten asked, how many of you know about novel psychoactive substances? Aha, many fewer, but good. So, what these are compounds where clandestine chemists go out and they add a molecule or two to well known drugs, and they synthesize drugs that will produce effects of cannabinoids or other stimulant drugs like amphetamines, etc. And they're completely synthetic, and we know very little about it. In fact, my last, I guess, 8 years at NIDA, I really focused on novel psychoactive substances. And we had an agreement with the DEA that when they found them and they appeared to be a problematic drug producing harm, we would figure out how it was metabolized because we didn't even know what these drugs were metabolized to. So most labs do not test for these novel psychoactive substances. In most cases, they have to go to reference labs that cost a lot of money. So when my investigation of these deaths, many times we found the presence of novel psychoactive substances that could be missed by medical examiner or coroner's laboratory. So again, comprehensive toxicology, very important. Now, another very interesting paper came out from the Florida medical examiners, and they looked at over 7,700 drug cases. They had many overdose deaths from fentanyl and other compounds. You can see that. And out of 7,700, only 106 had any measurable metragine. But again, you can see, of course, when you find fentanyl, most medical examiners and coroners are going to list that as the cause of death. But with metragine, even though it was present in a very small percentage of cases, 54% listed metragine as the cause of death. And this is just not realistic or based on science. Dr. Henningfield talked about our studies in rats and other species and how little respiratory depression there is. So there is a very strong tendency to list mitragynine as the cause of death, despite the presence of many other strong respiratory depressants. Now, if kratom is found along with other drugs, the appropriate way to do it is it's a polypharmacy death, and all of those drugs may have contributed. So there's absolutely nothing wrong with listing kratom as a potential contributor, but never to be listing it as the single cause of death when multiple other substances have been identified. Now, there were over 106,000 overdose deaths in 2021, about 75% due to opioid overdoses. And to our knowledge, none of these have been identified as kratom deaths. So when you hear that kratom is the cause of the opioid epidemic, there's just no basis for that at all. Many, as you've heard today from our speakers, are using kratom as a way of help self-managing their opioid use disorder or to prevent withdrawal, etc. as well. So again, when there are multiple drugs, all drugs should be listed as potentially contributed. We have a very important new paper that has come out recently, and it's from the individual scientists at National Medical Services, NMS labs, that does most of the mitragynine testing in the United States. Most laboratories, local and state laboratories, don't measure mitragynine. So what they have to do when they don't identify things or they find it in the home, it is frequently found in the home because the individual may have been using it to help with their opioid use disorder. So they send it out just for mitragynine because they have to pay for it. And we have very underfunded state and local forensic toxicology laboratories. They can't afford to pay for test everything, look for the novel psychoactive substances, look for other fentanyl analogs, etc. So they send it just out for mitragynine. They only find mitragynine and it gets listed as cause of death. What's important in this paper is they compared all the concentrations. And I have looked at cases that they reported mitragynine as the cause of death as low as 6 nanograms per mil. I mean, ridiculously low concentrations. So this paper has recommended you should not consider kratom as a cause of death unless the concentration is greater than 1,000 nanograms. Now, I want to point out, we do not know what the toxic concentration of mitragynine is that could produce severe adverse events and death, possibly. We don't know that. And guess what? As researchers, we are never going to give people that much drug to produce those negative effects. The first issue of doing controlled studies is don't produce any harm. But we're gathering a lot more data. When we publish our data on controlled administration, we'll be able to say, well, here are concentrations where people were walking around, going to work, students, etc. So that will help too. But this is a good step in the right direction so that medical examiners and coroners, when they look at these cases and they find levels that are much lower, they won't consider calling that. So again, most labs don't do the testing in-house. It has to go out to an expensive lab. And therefore, we have many cases where that's all they looked for. And that's a real problem. Comprehensive testing is very essential. And so before it's called a kratom or mitragynine death, they need to do a thorough scene investigation, always critically important, to look at what potential drugs may have been available. They need to expand their testing to look for other potential respiratory depressants that could be contributing. They need to look at all the circumstances of death, which may give them ideas. And they need to look at the decedent's past, determine were there substance use disorders? Were there other evidence of drug use that might guide them to what other drugs they should be looking for. Critical to quantify mitragynine and 7-hydroxymitragynine, and then to be up to date on the literature where there's a lot of information now that we didn't have a few years ago about the lack of respiratory depression, about the other effects. So thank you very much, and we continue to work on this big problem.